So alcoholic liver disease bridges quite a few different diseases. Just by its name, you know that it's something that's caused by alcohol excess. But what we're beginning to learn is that, number one, not everyone who drinks excessively develops liver disease. And also some people who perhaps to you or I perhaps don't drink that much seem to develop cirrhosis. So I prefer to call it alcohol-related liver disease, although in many patients alcohol is the dominant injury to the liver. And it usually affects people in young adulthood or middle age, but it can affect people of any age, and it's probably the commonest cause of liver disease in the UK.
And who can get alcohol liver disease?
Pretty much anyone who's vulnerable to liver disease. So for instance, you might be talking to people about fatty liver disease. Well, we know that if you have a tendency to fatty liver disease, then the risk threshold is lower. And so anybody who drinks in excess of what their liver can metabolize safely might be at risk of alcoholic liver disease. But clearly, you know, if someone in the general public were listening to this, they would have in their mind a picture of someone who lives under a railway arch and drinks all day. But not everyone with alcohol-related liver disease is like that. In fact, that's a minority of the patients we see here. And a lot of the patients that we see here with alcohol-related liver diseases would look very normal to someone outside the clinic.
Do we know how alcohol damages the liver?
Yeah, we're getting better at that. I mean, we haven't fully understood the mechanisms, but one of the strongest predictors for alcohol-related liver disease is actually genetics, and we're beginning to unpick some of those genetic patterns that will predict these things. And in fact, we're finding that a lot of the risk factors that lead to alcohol-related liver disease are similar to the genetic risk factors that might lead to fatty liver disease. So some people have a kind of genetic vulnerability, and the alcohol just adds on to that, and if you like, it amplifies or accentuates the injury. Also, we know that certain other liver diseases will give you a vulnerability. So it's quite common actually for someone to be referred with alcohol cirrhosis, and for us to find that, yeah, there's alcohol damage, but they also might have too much iron in their liver, or they might have a problem with some proteins that are stored in the liver. So there might be more than one process that's damaging the liver.
And can the liver also be damaged by drugs?
Yes, it can, and it can be damaged by drugs that doctors prescribe, and it can be damaged by drugs that people take themselves, and perhaps the doctor doesn't know about it. So we know, for instance, that if you take cannabis, then that might accelerate fibrosis for a variety of reasons. We know that some drugs that we might give for skin diseases can sometimes cause fibrosis in patients. And actually, sometimes drugs that are given for all sorts of different things in the wrong person can react in a bad way with the liver and can damage the liver so badly that it stops working.